You found the latest installment of Optimal Anesthesia, the definitive resource for perioperative anesthesia care. Here, we explore the fascinating history of gamma hydroxybutyrate, GHB, and its practical use in the field of anesthesia. Since its discovery, GHB, sometimes known as liquid ecstasy, has generated a lot of buzz in the medical community due to its unusual effects. Despite its common association with entertainment, research on its possible use in perioperative anesthesia management is just being started. Let's start with some GHB history as it relates to putting people to sleep. To alleviate the discomfort of alcohol withdrawal, GHB was first developed in the 1960s. Some health food shops even carried it for a while. Unfortunately, it was taken off the shelves in the early 1990s owing to its potential for abuse and misuse. Despite its troubled past, GHB has showed promise in a number of medicinal uses, most notably perioperative anesthesia. There is still a lack of understanding on how GHB really works. It is a precursor and metabolite of gamma-aminobutyric acid, GABA, and it may suppress activity in the central nervous system by binding to either GABA receptors or GHB receptors, or both. There is a hypothesis that it acts as an inhibitor of the dopaminergic system, although this has not been definitively proven. We're embarking on a fascinating journey into the effects of gamma hydroxybutyrate, or GHB, on the human body. We often hear about the euphoric and sedative effects of GHB, but what about the lesser-known side of the story? Today, we're exploring a table filled with intriguing details, the adverse effects of acute GHB intoxication. Starting with the musculoskeletal system, GHB intoxication can lead to something called hypotonia. It's a condition where the muscles lose their usual level of tension, which can have some surprising effects. Now, moving on to the cardiovascular system. Here, we encounter hypotension and bradycardia. Imagine a sudden drop in blood pressure and a slower heart rate, two things you don't want to take lightly. GHB isn't all about euphoria, it can also induce hypothermia. That's when your body temperature drops below the normal range, which can have serious consequences. Next, we step into the world of the pulmonary system. GHB intoxication can lead to respiratory depression and something called Cheyne-Stokes respiration. These effects touch the core of our ability to breathe. The renal system, well, it's a bit of a mystery in this context. We're not entirely sure how GHB affects it. The hepatic system, on the other hand, has a theory. GHB is thought to likely induce P450 enzymes, but the full picture is still unclear. Here's where it gets really intriguing. In the neurological and psychiatric realm, GHB can lead to amnesia, somnolence/coma, nausea/vomiting, dizziness, confusion, seizures, and withdrawal symptoms like insomnia, anxiety, tremor, and even aggression upon sudden awakening from overdose. Picture this: a patient is scheduled for surgery, but there's a twist. They arrive in an acutely intoxicated state. What happens next is a medical puzzle waiting to be solved. So, let's unpack this complex journey. First, we lay the foundation with supportive care. These patients are often young and can handle the effects of substances like ketamine. But sometimes, the situation is so urgent that we need to provide emergency supportive care and establish a definitive airway right on the spot. Now, here's where it gets even more interesting. Acute intoxication can lead to intense agitation and even psychosis. Imagine trying to perform routine medical procedures like placing in 4 or attaching monitors while dealing with a patient in such a state. It's a formidable challenge. To calm the storm of agitation and anxiety, we often turn to benzodiazepines like midazolam or diazepam. These are like the soothing balms that help the patient find some peace. But wait, there's more. In some cases, acutely intoxicated patients, especially those with a history of GHB use, require aggressive treatment of withdrawal symptoms and seizures. It's almost like addressing alcohol withdrawal, but with a unique twist. And sometimes, things get even more complex. The patient's psychiatric state may demand the use of antipsychotic drugs, like the trusty haloperidol. These medications are like the bridge that stabilizes the patient's mental state. High-dose ketamine intoxication introduces another layer of complexity. In these situations, patients may be severely affected, raising concerns about aspiration. That's when we need to take extra precautions to ensure the patient's safety. But there's an intriguing aspect to this. The effects of GHB can likely reduce the minimum alveolar concentration (MAC) requirements. It's like GHB is rewriting the anesthesia rulebook. And here's the curveball: many of these patients aren't just dealing with one substance. They're often engaged in polydrug use, which can turn the clinical picture into a complex mosaic. Now, in cases where there's a hint of aspiration in a patient showing signs of respiratory distress and low oxygen levels, the safest course of action might be to continue mechanical ventilation postoperatively. Optimal Anesthesia has more episodes like this GHB experience if you're interested in health and wellness. New, enlightening episodes will be coming shortly. Have a healthy dose of curiosity till we meet again.